Okay, my name is Linda Robinson, and I've been a genetic counselor for a little over 30 years. And I now direct the cancer genetics program at UT Southwestern in Dallas. So I want to talk a little bit about expanding the profession and the role of the genetic counseling assistant. So what is a genetic counseling assistant and why do we need them? Well, this is Leslie. She was one of my genetic counseling assistants. She's now a second-year graduate student at the University of Houston program. And this whole topic came up because genetic counselors were getting overwhelmed. There was an opportunity. We were overworked, there were too many patients, and there weren't enough of us. And so we determined that we need to maximize the skill set of a genetic counselor. And there was a study that came out earlier this year based on a group from Israel that looked at medical geneticists and genetic counselors, and they found that 11 to 25% of their time they were doing administrative activities and not patient care. When the professional status survey came out from NSGC, 62% of genetic counselors reported an increase in work. But that increase in work came with a cost. 44% didn't see a change in office staffing, and 22% actually saw a decrease. So as my boss puts it, we have to see more patients with less resources, which leads to job dissatisfaction. So interesting, from the NSGC professional survey, the number 2 reason why genetic counselors are dissatisfied in their job is lack of secretarial or administrative support. So what I want to talk about today is 3 different areas. I want to give you a little bit of a history of the genetic counseling assistant position, talk about a grant that we wrote through the National Society of Genetic Counselors called the Audrey Heimler Special Projects Award, and then talk about a thesis that was done by one of my genetic assistants at the University of Michigan on optimizing the utilization of the genetic counselor skill set. So first, creating the genetic counseling position. And I say all good things start with wine. So I was at an NSGC meeting having a nice glass of Merlot with my friend Beth Crawford at the University of San Francisco. And we talk frequently trying to find areas that we could improve our systems. We both work in large academic centers, and we control clinics that are run at the county facilities. So we're always trying to share ideas. So in 2011, Beth told me, I just created this position. She goes, I'm calling it the genetic counseling assistant. The hospital is calling it a hospital assistant. She went on to tell me what her genetic counseling assistant was doing and that every one of her counselors was quite happy, and it's just made their lives a lot easier. So I immediately left the meeting, went back and did a job analysis form with my human resources department. And they at first laughed at me, and it's a university of 20,000 employees, and I wanted to write a job description for one person. But I got it through. It took me a couple months, but they wanted to know who is a genetic counseling assistant. And I said, this is not like a regular administrative assistant. I want somebody with a bachelor's degree in genetics or biology. I can train them to do a lot of things, but I don't want to train them in basic science. What? And I gave them a job description. I basically borrowed the job description from my friend Beth. And why? We were drowning in patients. We had a 6-month waiting list, and we couldn't see enough patients fast enough. So I got it through my university, and I think this is the first place that actually calls a genetic counseling assistant a genetic counseling assistant. The salary was half of what a genetic counselor would make. This is what I learned was what somebody with a degree in biology would make coming out of college. And then we debated, how long should we have a genetic counseling assistant in our practice? Beth had made him commit to a 2-year cycle before she'd let him apply to graduate school. I thought a year would be fine. And that was another hard sell with my administration, because what was I going to do with the position turning over and over again? Oops, I think I missed one thing on there. Okay, so I didn't mean for you to actually read every detail on this slide. I figured if you downloaded the slide set, you would have our job description. But basically what a genetic counseling assistant does in my clinic and in the clinic at UC San Francisco is I have them call out all of my negative results. I actually have them call out all my results with variants. They write all the follow-up letters, and this is all done under the direction of a genetic counselor. In my institution, we live in little cubicle heaven with a little pod of 4, and there's one genetic assistant with 3 genetic counselors sitting side by side. So everybody hears what the genetic assistant is saying, but the genetic assistant is actually learning from all the genetic counselors that are seated around her. They deal with everything related to insurance, which all of my counselors were so excited when the assistants took over this role. They're doing letters of medical necessity, they're helping in research projects. This last year I successfully wrote 2 large grants, but my assistants did my whole EndNote library for me and all my lit searches. They do data entry, they contact labs and keep track of all of our results, where they're at in the lab, when I'm getting them, so we're not losing anything. And we're a big clinic, we're testing about 350 people a month. And so it's a lot of results to keep track of. We bring them into our big clinics. I literally have the assistant tell me what to do. Okay, give me a chart, point me in the direction of what room you want me in, and they control our whole clinic flow. They box up all our blood samples, they fill out all our test requisition forms, though everything again is under the supervision of a genetic counselor. So there's very, very limited data. So I met with Beth this last weekend and we totaled up how many genetic assistants that have graduated from our 2 programs, and that's only 25 people. So this is something that's a new topic, though since we first spoke about this at NSGC 2 years ago, I pretty much average a call a week of people asking me, how do I get one of those? How do you train them? How do you find them? So how do you find a genetic counseling assistant? Because I think this would work in any area. We're doing it in cancer, but there's no reason you shouldn't have a genetic assistant in a pediatric or prenatal setting. The first thing I do is I got to know all the program directors in my area. And after match day, I said, I want those that you think can get in with just a little more help. I want the bridesmaid. I want somebody who is number 9 and you took 8. I want the cream of the crop. Don't give me somebody that'll never get in. And so all the program directors now email me after match day. Okay, Linda, here's 3 or 4 ones I think you need to take. The program directors are also telling all the students when they call to say, why didn't I get in? They're telling me about my position. I also looked up every human genetics professor in the state of Texas, Oklahoma, and Arkansas. And I have an email list, and I email them twice a year, reminding them that I have this year-long internship for somebody they think might be interested. And I get referrals that way. I used to talk at all of our local meetings in Dallas, but now I stopped asking them for referrals because we're all going after the same people now. And pretty much every center that does cancer in Dallas now has their own genetic assistant. And we have lots of students that are always calling us asking, I want to go and be a genetic counselor, what can I do? So I say, come observe us in clinic for a day in our case review, and then I tell them about our genetic assistant position. Last year I had 40 applicants for 4 spots, and they were all very, very qualified. I'm starting to get a lot of medical students that want to come into our clinic for a year just to get exposure to genetics before they start medical school. So I get this question frequently from my administration is, what's so different about a genetic counseling assistant? I've had assistants for years in my clinic. Or I've heard people say, why have my genetic counseling students do all this kind of work? And I would argue that the genetic counseling students do not need to be spending their whole 2 years Xeroxing, that there's other things they need to learn. Now, granted, they need to learn the basic office structure, but that shouldn't be their focus of their training. So I put it in their job description that they have to have a degree in biology or genetics or I won't look at them. I'm now asking their GRE scores and I'm asking to see their transcripts. If I don't feel this person will actually ever get into graduate school, I wouldn't hire them. I'm looking for somebody that has a desire to keep going on in the field of genetics. I want somebody that's motivated. I don't want to have to train the science, so very different than my assistants who have no background of, I don't have to explain what a missense mutation is or what a variant is. So my administration had a completely different view of what the genetic assistant should be for me. The first thing they said is you need to document cost savings. I was told, Linda, this is a trial project. We'll give you a couple years. Prove to me that it works. They wanted to see that the counselors were seeing more patients, and I'll show you some data on that in a minute. They were also concerned about liability. You're giving somebody that's a genetic counselor duties that maybe the genetic counselor should be doing. People were very hesitant that I was going to have them call out my test results. And I reminded them when was their last time their own doctor called them with all their routine negative test results. No, we have a tracking form, so sometimes a negative genetic result is not necessarily good news. And so the counselors always had the option to say, nope, I want to call this one. This is going to be a different result for this family. My employer had a lot of concerns about somebody only wanting to stay 1 or 2 years, and I told them I'm going to build my own pipeline. And I've already hired 2 of my former assistants, and I'm going to be hiring a couple more back this summer. They know it's very hard to find genetic counselors, and especially if you're in a hard area to recruit, this is a great recruiting tool. You know, they come live with you for a year, you like them, they like you, and you can hire them right on back. It did improve the job satisfaction for our genetic counselors at our institution. Every 2 years, our institution has an employee satisfaction survey, and we've never done bad. But the year we instituted the genetic assistant, and every year since then, we're the #1 group in our university. So my little group of 20 people is #1 out of 20,000 employees. And if I ask my counselors, why did you like your job? What do you like about it? And they all say, I get to do what I was trained to do. I'm not doing a lot of paperwork. And they all love their genetic assistant. So some of the general responses that we got back from genetic counselors that work with, we call them the GCAs. They have less busy work, they're increasing their patients. They get to focus more in their counseling session on what they were trained to do. And the negative thing, it does take time to trust them. And I notice this with the newer genetic counselors, they're not willing to relinquish some of their job duties to the genetic assistant right away. The older genetic counselors were just happy, here, take this, you can do it. I'm not a very happy person every July because my 3 or 4 genetic assistants leave and I have to break in some new ones. So July is pretty rough. We do have a manual and we're working on even like little video clips and ways to teach them stuff pretty fast. And I usually have a month overlap with them. And I think we need to start opening our eyes and looking at other professions. Sometimes we look within our own profession for answers. And if we look at many other professions, there are tiered professions. A physical therapist is a great example. They're master's trained or now the doctoral programs in physical therapy. They diagnose and treat patients, but they have a physical therapist assistant that helps them implement some of their plan. And in both of these cases, they are licensed, all the way down, in some states even licensed the physical therapy aides. We all know about nurses. I don't think I've ever seen a nurse practitioner change a bedpan in the hospital, but you have the LVNs. You have different tiers and different job responsibilities based on their level of education and experience. So I would argue that genetic counseling could be the same. When I started genetics in the late 1970s and early 80s, there was an uproar from the genetic counseling community about the sickle cell counselors. That this new type of training, they were going to take over the genetic counselor's job and there wasn't going to be enough work to go around. I think there is enough work to go around, as everybody in this room can vouch for it, to add in help. So in 2014, at the urging of my employer, who wanted data on what a genetic counseling assistant is, we applied for a grant through the National Society of Genetic Counselors called the Audrey Heimler Grant. And I worked with my colleagues, Sarah Pierzadeh-Miller and Beth Crawford, and we kind of outlined what we wanted this grant to look like. But then I gave the outline to my 2 genetic counseling assistants, Sarah Pass and Parker Reed, and I said, it's time for you to learn how to write a grant. And I put them in a room and they helped write the grant. Again, these are college educated, and they took it on as a challenge and came back to me 10 pages later and said, what do you think? And it was great. So the goals of the grant was going to be a survey. It was going to be a limited survey because we wanted to survey people that actually knew a genetic assistant or worked with a genetic assistant, with the exception of the program directors. So we sent out the survey asking a couple things. First, we wanted to evaluate the efficiency of the genetic counseling assistant. Did it really change their clinic for the genetic counselors that were going to reply? From the program directors, I really wanted to learn about their attitudes toward the expansion of the field of genetic counseling to include the GCA as part of a service delivery model. And then I wanted to gather information about the job task of a genetic assistant and what everybody thought of those particular tasks. So we sent out the survey in the summer of 2015, and we got a pretty good response. And some of the genetic counseling, the majority of the genetic counselors worked either at UT Southwestern or UC San Francisco, but some had gone to other institutions, so we surveyed them as well. And anybody that I knew in the area that also had a genetic counseling assistant, I surveyed them. So genetic counselors, for those counselors in the room, we never agree on anything. You put 100 women in a room, you're going to get 100 different answers. And we asked one question off the bat was, did the genetic counseling assistant increase your efficiency? 100% of the people agreed. It definitely increased efficiency. And we structured our survey to get both quantitative and qualitative data. It was a quick look, and again, it's based on 2 institutions, but we asked genetic counselors, what did this do to your patient volume? And it increased it 60%. So this may be hard to see, so I kind of want to walk you through what I did. So I looked back before genetic counseling assistant and how many patients my genetic counselors were seeing in my clinic. And it was averaging a little over 300 a year. And then I took each year as we added genetic counseling assistant positions and started to look at what was the perfect ratio. How many assistants did you really need to make an impact in the clinic? And so the first year we had 7 genetic counselors. I added 1 assistant. We saw a 5.7% increase in our patient volume. Bring down to 2015. At that time, I was 9 genetic counselors to 3 assistants, and my increase in patient volume was 58.5%. Now, every practice is going to be different. I'm in an academic institution, so my counselors don't see patients 5 days a week. They're expected to publish, do research projects, and they're expected to teach. So kind of what does this mean? And if this is probably my best slide to kind of take home kind of what we've done. So with the ratio of 3 genetic counselors to 1 genetic assistant, we saw 58.5% more patients. So that was 182 more patients per genetic counselor, or 546 more patients for 3 genetic counselors. So start doing your math. When I have now 11, I'm soon going to have 15 counselors. And so 3 genetic counselors could then carry out and see the same volume of patients as 4.75 genetic counselors. And I was paying the genetic assistant half of what I would pay 1 genetic counselor. So this was the slide that meant the most to my administration. They said, hire as many as you want. Because they could see we had more billable hours, and the counselors went from seeing a little over 300 patients. This year, my counselors are seeing about 550 patients a year. And so the genetic assistant made a dramatic effect on our patient volume. I like to say it's all due to the genetic counseling assistant, but as the program has grown, we're always constantly trying to make ourselves more efficient and cut down redundancy. But I would say the genetic assistant is a big factor. Okay. So job duties. I kind of told you before a little bit about what the job duties were, but we wanted to see how individuals felt about the job duties. And the biggest thing that we learned is that the program directors did not like the fact that the genetic counseling assistants were calling out results. That was very much against it. And we all agreed that the assistant should never call out abnormal results, but the calling out of negative results was the one big thing we learned. We looked at the evaluation of the attitudes about the genetic counseling assistant. And most genetic counselors felt that this was a great career path for genetic counseling students, and to get them into programs. But the program directors didn't feel that way. They said, nah, I don't want anybody to feel that since they were a genetic counseling assistant, that was an automatic shoe-in for a genetic counseling program. A lot of the genetic counselors felt that this could be a standalone career. We get a lot of requests from individuals with a bachelor's in biology, and they don't know what they want to do, but they don't want to go to graduate school, and they don't want to work in a lab. So we do see in the future that some people will want to see this as a terminal position. And we did have some of the program directors concerned about our title. And for those of you that are old, I remember when genetic counselors were called genetic associates on the West Coast and genetic counselors on the East Coast. And so there's always been controversy about what we call each other. And I don't think the genetic counseling assistant is any different. I see their point because I see some confusion in the nursing world. What's the difference between a nurse practitioner and then the nurse that's on the floor? So from the patient's point of view, we might have to think of a new name, but for right now, we're calling it genetic counseling assistant. And the program directors were very concerned that genetic assistants would take jobs from the genetic counselors, going back to even the sickle cell counselors taking jobs from the genetic counselors. I don't think this is an issue. I think we have too much growth in our profession, and if we don't find a way to solve that, other people will take over our jobs. So from the genetic assistant's position, I have a lot of people say, well, if I come to work for you for a year, what's going to happen to me? And I can honestly say the majority of them get into graduate school. They have far more experience, they know what they want to do, and now they're firm believers. They've watched genetic counselors, and they really believe this is what they want to do. Our acceptance rate is 83% compared to 31% of people applying from college. And the majority of our genetic counseling assistants felt well prepared. They've learned the hospital system. I think they know more about billing than most genetic counselors by the time they were done with a year. So I want to bring on to the third area I wanted to cover was a thesis that was done by Parker Reed, one of my former genetic assistants. And it was finding the right mix, optimizing the utilization set of the genetic counselor. And the objective of his thesis was to identify ways to improve efficiency through the delegation of certain roles to other individuals, pretty much what we've been doing with the genetic assistant. And then to identify ways in which genetic counselors can prioritize their time and use their specialized skill set better. So this was another survey, but this time it was sent to the entire NSGC membership, to 4,000 people. He got a response rate of complete responses when we kind of whittled it down to 316. We wanted to see just people that did clinical work, though we know there's a lot of genetic counselors in industry, newborn screening, but we wanted to see just those in a clinic, what kind of impact that's had. So other people that he surveyed in a clinical work, you can kind of see the little pie chart there, that there were cancer, prenatal, pediatrics, and a little bit of everybody doing genetics. And so the first thing was what tasks were being performed in the clinic. So made a list of everything that was happening and which individual on the clinical team was actually doing that task. Then we looked at, and we broke these tasks into three groups: genetic counseling task, administrative task, and professional development task. And we wanted to know which of these tasks took up the most time. And then out of the time-consuming tasks, what were the genetic counselors most willing to give up? And then if they weren't willing to give it up, why weren't they willing to give it up? And what did they think would happen to them if they gave up some of these tasks? So I break up these tasks into the green task, or the administrative task. And the most time-consuming tasks were filling out the test requisition forms, contacting labs and monitoring results, scheduling, maintaining referrals, insurance authorization, and copying and scanning. And that pretty much is my job description for my genetic assistant. So the genetic counseling tasks were clinical documentation, testing options and informed consent, so the genetic counseling process, obtaining a family history, patient clinical education, and reviewing literature, versus the professional development roles where the supervision of students, management roles, and professional education. So then we asked genetic counselors that spent their most time, and we looked at their whole time and how was it broken up. And 75% of their time was either on the genetic counseling task or the professional development task. But 25% of their time was doing those administration roles. And this went hand in hand with what they found in Israel. So I want you to think of your 40-hour-a-week work, if you work 40 hours, and if 10 hours of that week is doing administrative tasks, that's 520 hours a year that maybe could be delegated to somebody else. And then start multiplying that by the number of clinical people that are doing administrative tasks. And we actually broke this down per specialty. And we're looking at it like how many of the cancer counselors, what was their GC task? And luckily that still is the majority of our job. But the administrative tasks, the counselors that were doing the most administration were the pediatric counselors. And so I think they would have the most benefit from having an assistant. I didn't mean for you to read every bar in this slide, but if you remember, the green is the administrative task. And we ask counselors, are you willing to delegate what percentage of these tasks? And we looked at the top time sucks. And as you can see just by looking at the green bars, is that most of the counselors were willing to delegate off these administrative tasks. And I wanted to highlight a few, was test ordering forms. That's about 75% of people felt comfortable having somebody else fill out their test ordering form. But what surprised me was that a third of the genetic counselors were willing to give up the family history and have somebody else take a family history. Now, in my own institution, we've given that up in the sense that we have the patients do it online ahead of time before the appointment. And then we review that with the patient, but that has saved a lot of money having patients fill that out ahead of time. And that kind of surprised us. We're now breaking down this data based on the age of the genetic counselor, and I suspect that we're going to find that the older the genetic counselor, the more likely they are willing to delegate. So we ask counselors, if we free up some of your time, what is your perception of what you're going to do? And it's basically everybody felt they're going to increase access and they're going to improve the quality of their care. They'd get to focus more on what they were trained to do, and they'd have increased time for professional development. And overall, they felt they would be happier. When we asked them the barriers of delegating the task, the first thing was the proper training of whoever was going to do these roles. They wanted to make sure that was in place before they gave it up. They did worry about this contributing toward their professional development. Will this hurt them if they keep giving up tasks? And there are actually some people that enjoyed Xeroxing and filing, so they can enjoy it, but that they didn't want to give up that. And part of that, I think, is we don't like to give up control. So kind of in summary, I don't think the genetic assistant is the universal solution for our gap in services, but I think it is part of the solution. We're going to have significant variability between subspecialties. So what this position looks like in my clinic in cancer could be very different than in a metabolic clinic or a prenatal clinic. And we need to look further, dig through some of Parker Reed's data to kind of tease out what the benefits will be for each subspecialty. Some counselors are just not going to want to delegate, and that's kind of their prerogative, but from an administrator, I would want to see efficiency and the ability to reach more patients, and that's going to involve some form of delegation. Utilizing support personnel will allow genetic counselors to do more of their core functions. And this is a profession that we're going to need more and more counselors, and we want to keep the counselors that are working out there very happy. So giving them a job where they're doing all their own scheduling is not going to make them happy. So it's going to add to their value added. It's going to give them more opportunities for professional development. So where I see some problems in the future, I've already been approached about should this be regulated. Like we license genetic counselors, should we be licensing genetic counseling assistants? And other professions have licensed their assistants. In the United States, almost half of the states have licensure. But those going forward, I think, are going to need to address this role somewhat. Again, in my view, it was somebody with a degree in biology or genetics. But the question is, how many people are going to call themselves a genetic assistant without a strong science background? Should there be an exam for genetic assistants? I'm going through grade point average. I want to see what they got in biology and chemistry. Going back and keeping asking counselors, and then expand this to medical geneticists. What do you need taken off your plate? What are you doing that's causing you not to be able to see a lot more patients? And then what will this delegation look like? So I ended with a lot of questions, but we wanted to spur some discussion. And I put my phone number and my email, so if you need any job descriptions, happy to send you anything that I have. And I'll open it up to questions. Thank you.